first signs of an intoxication are lack of energy, but also remember an affective disorder. How do people get up? How do they go to bed? How do they sleep, especially when they wake up many times during the night? How is the libido? That's not only lust for sex, but also the lust for life itself. It's a hormonal thing, hypothalamic. Women especially report a change in hair quality, which is a trace element condition. And people also report a changed sense of temperature. That's not a true sense. They have maybe low normal temperature, but the sensation, oh, I'm always cold, or I'm always so hot, that's the change they experience, which is also a hypothalamic disorder. Easy muscle ache after a little bit exertion, headaches or digestive disorders. And when you have already concentration or memory problems, then you are already far gone. What do we do before we commence any treatment? We have had these four now. I call this the combination of intra and extracellular test. Check the spine, low level lead and blood pressure. Mainstream medicine is now recognizing that lead might be a contributing factor to hypertension. Then you can do full blood analysis. That's a German test where they take the blood and they don't only take the plasma, but they make the red blood cells destroyed, and then they compare the total value with that of plasma. And then they say, this is an intracellular test. Well, that's only true for blood. It's an intracellular test for blood. Many people have in this test a very low zinc, especially obese people, and then they are given zinc, or cancerous patients who have very low copper in this test, but when we measure in the palm of the hand, they have excessive amounts. So by giving them zinc or copper in that instance, you are making the condition worse, although this test tells you you should give it. It's the same problem as with chronic inflammation and iron, that in chronic inflammation, serum iron is lowered, but the ferritin increases. What does that mean? It just means that the iron is displaced from the extracellular to the intracellular environment. So when you have an anemia of chronic inflammation in a cancer patient, would you then give iron in high dosages just to correct the anemia? Yes, if you want to kill the patient prematurely, you should do that. But if you want to help him, you should make sure that the intracellular iron is displaced back into the extracellular space, so the bone can resorb and can produce red blood cells. The same accounts for zinc or copper or any other trace element. You cannot just compare these tests and say, oh, this is a wrong method or this is a good method. No, you need to consider in which environment am I measuring now. Is it extra or is it intracellularly? Hair mineral analysis, a very good test for a very long time because it was the best we had. I will come to this profile a little later. It's just to show here that generally you have to consider that 90% of the human hair is in the growth phase, and in that time, only when they grow, they can incorporate any element. And they can only incorporate what's in blood. So when the blood supply is high, then they will absorb a lot. The blood supply is low, they absorb a low. But hair mineral analysis also has its limitations. If we just know that, it's okay, because in autistic children who are heavily exposed to aluminum and mercury, you in general find very low levels of mercury and aluminum, which is also very logical because these metals are situated inside their brain cells. Therefore, they cannot appear in their hair. So it's kind of limitation as well. But it is a good test. If you have a good lab, it's a good test to do. Then we do a provocation test. Very useful because it's not only a test, but it's also a treatment right away. Because with these chelating agents, you lose a lot of metals once they are located in your extracellular environment, which is your blood and the matrix outside the cells, 15 liters in total. That can be cleansed of metals when you do a provocation test. Any provocation test with common chelating agents will not clean your cells. It's impossible. These chelating agents do not penetrate cell membranes. That's what they determine. Here you have a provocation test like we do. we inject within half an hour 2 chelating agents. One is called DTPA and the other one is called DMPS. Together they cover the whole spectrum of toxic metals, especially DMPS is a very potent general chelating agent. DTPA cannot bind mercury, cannot bind arsenic, cannot bind silver inside the body. There's a difference between inside and outside the body. In test tubes, yes, but inside the body not. Has to do with all kinds of ligands like sulfur. But here you see a patient with an extremely high mercury, 134 micrograms per gram of creatinine. It's very much. And you are in the 90% percentile and higher. So this patient has a lot of heavy metals in the extracellular environment. Very good detectable by a provocation test. You want to know more regarding the provocation test, write an email to this doctor. As I said, 88 years of age, still updating the textbook every year or half year. It's already now the 14th edition, and it's the standard teaching book regarding all toxic metals, but also all trace elements. All metals, trace elements, and treatment regimes, all orthomolecular medicines you need for detox, etc., are being spoken of in this textbook. Then we come to the spectrophotometry. That's a live measurement. That's one thing to recognize. Living tissue is different than when you take it out and it's dead. And the key difference between all other tests and this one is the cell membrane. Because how it works, if nobody can explain you how, but when a beam of light, which is quantized, every beam of light which comes out of that device is a certain amount of light. And we know already from hundreds of years ago, light is also a photon, and a photon you can count. So many photons are coming out with a certain amount of frequencies, so momentum. And when the momentum changes, then you can gather from that, you can calculate that when so much red has been absorbed and so much green has been absorbed, there has been something responsible for that. And that are metals, because metals have a color. Magnesium green, cobalt blue, or copper red, or whatever. So they have a color. And that's, of course, their secret, how the algorithm is calculated. Anyway, when that beam of light hits your skin and starts measuring, it has to penetrate at least one cell membrane. Otherwise, it cannot measure at all. So the crux here, the major difference between these and other tests is the cell membrane. How's the technology? It measures optical density. The same device is used in car industry. It's exactly the same device because when they want to make a color on the car, they put on the spectrophotometer. It determines the exact frequency of the color, and then the machine who makes the color can exactly produce that color. It's exactly the same machine. Only the computer behind it, of course, is different. There is a law, Lambert's law, which states more light is absorbed when the density of a substance is increased, which is very logic. And therefore you can make a quantitative analysis according to this law. The amount absorbed has then a log scale. And what you get is a unit which is not expressed in a unit. Because what they do, you have that amount of light which corresponds to an amount of magnesium or zinc. That's milligram or whatever amount it is. And you divide that by total body weight. And when you divide milligram by kilogram, you get a unitless expression. And that's understandable, I think. And unitless, you can also then say ppm. Then you call parts per million or parts per trillion, however you want to quantify it. Therefore, you see no expression on this sheet because it's a unitless measurement. But it is quantifiable. How do you do it? Well, it's in 4 steps. You measure 4 places of the palm of the hand, because every race has the same color and you don't have to put off your clothes, so it's very easy. The machine starts calculating, that's the spectrophotometrical analysis, the algorithmic calculations, how can we convert these amounts of frequencies into a real unit of milligrams, and then you get the results within 10 seconds. And the advantages are, it is non-invasive, it is direct. You don't wait weeks, the patient, like in hair mineral analysis, they had to wait 3-4 weeks, and then to come back to discuss the results, and that meant already a second consultation. Now we do it during the first consultation. So the patient benefits 3 advantages: less money, less waiting time, and no second consultation. You can make a direct treatment plan. It reflects much better the patient's condition on a tisular level, but you have to remember it is still only skin you measure. You don't see directly how many metals are located inside your brain. You measure the skin of the palm of the hand. But by making a lot of analysis and comparing results, we can now deduct, we are able now to see when a specific profile with a specific patient, how you can interpret the results more effectively. This is what I do in general to say. Here you have that cell membrane. This is the extracellular environment, and that the intracellular divided in liquid, the matrix, which is liquid and intracellular, and then pure intracellular itself. All organs try to excrete. When you have a little nasal problem or lung problem, you will produce mucus, which is just an excretory product. So when that system is overloaded, then the body needs to do another mechanism because it cannot hyper-excrete anymore. Then it will do an inflammation of the membranes. Then you have a sinusitis or a bronchitis. And in most cases, those are then suppressed by antibiotics, which does not heal the body. It just bypasses the problem for a certain amount of time. So when you do many antibiotics or corticosteroids, you just suppress the symptom, and then the metals or other toxins are just deposited inside the matrix, where we cannot see them with any regular diagnostic tool because they are deposited far away from blood, but they are there. And when that system continues, that mechanism continues long enough, then the toxins are moved inside the cell. You get impregnation. So as I always tell to the patient, the following example: you live in an area where you have several houses with many streets in between. The streets are your lymph and your blood vessels. It is the extracellular. Inside the houses, the people live. That's intracellularly. And when you look at an environment, you cannot tell from the waste products outside on the streets how it looks inside, because it could look very dirty outside, but inside the houses could be very clean. And the reverse. Houses can be very, very messy, but the streets are very, very neat. And you think, oh, this is a nice, neat neighborhood. But inside the houses, many, many toxins are deposited. You cannot see that, only now. And when the impregnation continues, because first a toxin comes inside the cytoplasma, it's bad, but not as bad as when the toxin is now getting into the organelles, the organs of the cell, like the mitochondria, like the endoplasmatic reticulum. Then even organ function inside the cell is inhibited. Toxins can get into the nucleus, and then you can have a lot of diseases associated with that. You have a fever, you get antibiotics and a painkiller, you develop a rash, an dermatitis. It goes away silently. Then the people develop a tonsillitis, an inflamed tissue here. They get another set of antibiotics. They develop diarrhea. It gets silent again. Another tonsillitis, that happened in my life. And then again diarrhea, colitis is developed. Some people then, you know that people who are a lot of tonsillitis or a lot of dermatitis eventually develop asthma. That is then inhibited by corticosteroids. And when that is even prolonged after 10, 20 years, they might develop Crohn's disease. They can get arrhythmia through that, or they develop colon cancer. This is also a scheme of Ronald Reagan's, of the former president of the United States. And when you treat colon cancer, the colon cancer is gone, but almost invariably they all develop Alzheimer's disease. Can only be explained by meridian literature, because the colon and brain have to do with metals. But just to show how you can follow a patient's history around the chart like this. When you have mercury in your system, you can have it outside the cells or inside the cells. And then you have to remember, this can measure outside, and this has to measure also inside. I have no idea about the amount it would also measure extracellularly. But from the studies we performed in the clinic, I can just conclude that it is mainly an intracellular measurement, as shown here. Now we have a provocation test. You see almost no heavy metal, lead, you see, and a value 18, which is really nothing, 18 micrograms per gram. But the same patient, which has illness and is very sick, shows this heavy metal profile in the scan. Maximum or almost maximum oxidative stress with very high mercury. The mercury intracellularly very high, extracellularly almost non-present. How is that explainable? When we saw one of these profiles, the doctor I worked with thought, we have another device which does nothing. But I just remembered that scheme what you saw with extra and intracellular, which is from a German physicist from the late 50s. His name is Reckeweg. Immediately I got the image of Dr. Reckeweg, because I knew at that time with the first patient, when we don't see it extracellularly and we see it here now intracellularly, we just have to follow the first 100 patients and see what will be coming out of that. So we did that. We did a provocation test with dechelating agents. We did an oligoscan, and we found this correlation. So the higher the mercury is in the spectrophotometrical analysis, the lower it is excreted in the urine. The higher it is in urine, the lower it is in the oligoscan, which is all logic, because when it is present extracellularly, it is not present intercellularly. And when it is present inside your cells, it will not come out with even one of the most potent mercury binding products. And the Pearson correlation is extremely high. Statistics, friends have told me, this is just ready for publication. And I said, yes, we already sent some, but it's difficult to get it accepted because they ask you for the method. And the method, of course, it is easy explainable provocation test, but the oligoscan, how does that work? Nobody tells you. And because you cannot explain the method, they will not accept this kind of study. What I think what will happen is that very slowly around the world, some people will accept this method and will do their own research, and everybody who has already found something, that will all come together, and it will, in 5 to 10 years, will be accepted as something normal. And then major magazines will come back and ask for something to be publicized. But now it's very difficult because I cannot explain the method. Nobody tells me as well how the calculations are done. So this was especially found in people with high oxidative stress. So when you see a profile like this, high oxidative stress, when this is in the red, you almost invariably see a high mercury. That's the whole story from the beginning. Mercury causes mitochondrial dysfunction due to all these reasons with glutathione. Therefore, oxidative stress increases, and therefore the cell does not function anymore, and you cannot get rid of the metals. They stay intracellularly. So the conclusion from this study or observation, that in patients with high oxidative stress, there is a very strong negative correlation between the oligoscan and the provocation test regarding mercury. So a high mercury content in the oligoscan correlates with high oxidative stress, which is very logical, as I explained this morning or this afternoon, of the relationship of sulfur and selenium. And in people with high oxidative stress and high mercury in the oligoscan, chelation with even the most potent DMPS will show nothing of mercury. How is it in people with normal oxidative stress? Can we predict if these people then have high mercury in the provocation test or not? Well, you cannot. That's the conclusion. You have to perform a test to see if they are metal loaded in the extracellular environment. Whether you do our kind of test or a test with DMSA or whatever you want to use, but you need another test to show or to prove if the patient has a problem with toxic metals. Because this is the profile of someone with very good oxidative stress. You will have many people here like that. Of course, we also see the aluminum signal that we have addressed, a very common metal in the surroundings. But how about the provocation test? Well, this patient eliminated much mercury, 56 is already high, and you see many more metals elevated. But you cannot predict, because you could also have patients with good oxidative stress and low metals here. And of course, those are the really healthy ones, because when you don't eliminate extracellularly and you don't have anything intracellularly, then you are just blessed as a person. If you now still doubt the story regarding the oligoscan, I have one more thing for you. I come back to this hair mineral analysis. This is a hair mineral analysis where we see at first a high potassium and iron. And I tell you, this is a Brazilian marathon runner. What proves that he is a marathon runner? That's the high sodium and iron. Why? He runs 40 kilometers each day, 2 days, and with their heels, they smash their red blood cells when they are running. And then when the red blood cell is kaput, destroyed, a lot of sodium and iron is released. And that's a constant high level in his blood, upper range, and that is just lost in hair. Very simple. So the method proves he is a marathon runner. But he was very concerned about his high calcium there, extremely high. And he did not use any calcium supplement or whatsoever. Being concerned, he met someone else in Brazil, a French guy, and he performed an oligoscan. And we just look at the calcium. Extremely low. He was even more confused. Then I got the question, can you make any sense of this? And knowing my intra and extracellular story, and I had patients who had this kind of profile as well, we started an idea. And the idea was to show this is hair and this is spectrophotometry, this is extracellular, this is intracellular. How can we combine these two paradoxal facts? This is one of my own patients. Was also very low calcium. But what is important in calcium metabolism in our body? Everybody will argue nutrition, yeah, sure. But what is very important to get the calcium inside your cell? One, of course, is vitamin D. So that would be sunlight. You can easily measure if it's enough, yes or no. But there is another thing which is very important, because you can have enough vitamin D in your body, but it doesn't mean that it works very well, because vitamin D has to work on the vitamin D receptor. And what appeared now in all of these patients with very low calcium, they are all, so far in our clinic, 6 of 6. I report here 5 of 5. The Germans have now proven a few cases, and it is in all of these cases that the patients have a genetic SNP of the vitamin D receptor. They call this a single nucleotide polymorphism. This patient even had all 3 related genes mutated, which means, and now can prove why it is, the risk for these patients are osteoporosis, cardiovascular disease, tumors, etc., which is logical because not of the low content of calcium inside the cells, but of the continuous high concentration extracellularly. The patient is just in lack of the receptor, or has a dysfunctional receptor, and therefore it appears in hair and cannot be transported intracellularly. This is the calcium paradox. You can check it now. Many laboratories can easily do it. It's about 80 euros, 8,000 yen maybe, or maybe here a little more expensive, I don't know, to check for the vitamin D receptor SNP. And knowing this, even if this were a lady with osteoporosis, would you give her high amounts of calcium? Yeah, if you want to kill her, then you give her high amounts of calcium. Calcium for these patients is toxic, and therefore you find always high amounts of calcium in blood in osteoporotic women, because they lack the capacity to transport it inside bone or inside their cells. So what you could do, you give high amounts of vitamin K2, because that is a substance which can bring extra of calcium, which is located outside the bones, more away from tissue. Vitamin K2 can liberate calcium from atherosclerotic plaques and can liberate it from cartilage tissue. You can give soy in some high concentrations, which has a somewhat potent effect for putting calcium inside the bones. Women in Indonesia have never seen a cow. They don't drink milk. It's my opinion. Milk is for babies. Milk is not for adults. And also not if you bypass 2 or 3 years of age. Look at an elephant. They become very large and very strong without milk after the first 2 years. We humans, therefore, you see lower capacity of calcium in people who use high dairy products. Because the dairy product, it's a bad form of calcium. It immediately reacts with phytates from nutrition. It binds and you lose it right away in the end. Calcium from vegetables is highly absorbed and usable. And women in Indonesia, when they fall, they never break a bone. When our women in our country, we are the most dairy consuming population in the world because we have more cows than per head of the population than any country in the world. We use the most milk of all people around the world. We have the highest incidence of osteoporosis. And then our general doctor says, well, you still did not drink enough milk. So what can we read more from the scan? This is a typical profile. When you see this profile, I don't have to see the patient. I know this is metabolic syndrome. I don't know if you can see it well, but you see a gray bar and you see a colored bar. The gray one is the first measurement. The colored one is a measurement thereafter. Can be the first, the second, etc. So this patient had a high calcium initially. Now it's normalized. He had a very low phosphorus initially. Now it's normalized. So some things have normalized, some things have not. But what can we read from that? We teach this in the complete school. We talk about that for 7 hours. But in short, high calcium is a sign of nitrosive stress. That's the inflammasome from the beginning. High calcium you saw there. Sign of nitrosive stress. Low phosphorus means your cell membrane function is compromised because phosphor you need for phospholipids. But also your energy level can be compromised. ATP, the P is phosphorus. Silicon, it's connective tissue. I speak 45 minutes in the medical school only about silicon, one of most forgotten trace elements we have. Zinc in this patient. A high zinc, as in this, has nothing to do with an intoxication. Nothing. This patient did not take any zinc-related supplements. It's just a sign of chronic inflammation. Why? Because the SOD enzyme, which is highly zinc-dependent, the cytosolic one, it upregulates when you produce too much radicals. So therefore, your body retains more zinc. In this patient, not corrected yet. Later, I can look up many other data for you. Now we know we give 4 weeks of berberine. I come to that at the end of the lecture. But when you give 4 weeks of berberine, all zinc is normal. It normalizes very quickly. And the high zinc is a sign of non-alcoholic fatty liver degeneration. Therefore, metabolic syndrome. When you see a very low chromium, like here, and it is an obese patient, then he has insulin resistance. When you see that in a person who is absolutely not obese, then you can have to do with, and that's not complete, this list, but you can have post-traumatic stress syndrome, you can have very bad sleep, phased sleep, you can have people who are in the acute phase of stress, but it all comes down to a lower level of IGF-1. Insulin growth factor 1. That's all chromium. Point out a very specific relationship of chromium and glutathione. And the relationship is that chromium is held inside your cells with exactly the same amino acids as you need to produce glutathione. So can you imagine too much radical stress? Your glutathione is gone, that you also miss the same amino acids to contain the chromium inside your cells. Boron. This morning I did not see boron highlighted as an essential trace element, but it is. It is very much an essential trace element, and I call it the hormonal one, because boron is very necessary in steroid hormone metabolism. So when you see an elevation in this patient, it does not mean he is boron intoxicated. It means that his body accumulates the extra boron to improve steroid synthesis, because the fatty tissue in an obese person who has metabolic syndrome, the fat cells are inflamed. They produce bad estrogens. And to counteract that, the body needs extra boron. That's what boron does. But boron has also influence as a neurotransmitter. It enhances adrenaline, for instance. It's all scientifically proven. So boron has more functions. But in this patient, always a sign of inflamed fatty tissue. I forgot here to highlight, but when you see cobalt, it went here to the left, here to the right, because I almost invariably give one course of activated B vitamins to the patient who is chronically ill. We have a special formula. We don't give B1 and B2. No, we give riboflavin 5-phosphate. It's active phosphate. We don't give B6. It's very bad to give B6 to sick people, in my opinion. But you give pyridoxal 5-phosphate. I don't give B12. I don't give cyanocobalamin. It's a toxin. You have to give methylcobalamin or adenosylcobalamin, which is the active B12. And when we give that, you also see after 6 weeks that cobalt increases. Invariably, because B12 is a cobalt-dependent enzyme or a vitamin. And therefore, you see in all our patients, when I have given the product, an increase in cobalt. Then we have iodine. Iodium means iodine. And iodine has, of course, not only a function for the thyroid function, but is also a natural antiseptic. And what I have observed, this is not clinically proven, it's an observation, that all patients with chronic mucous membrane problems have a very low iodine content. I think that most people here in this country will not have so low of an iodine content because of the fish consumption. We have many patients who are very deeply in the red. Lithium, also forgotten, it's a necessary trace element. It is a product for the bone marrow to produce white blood cells, lithium dependent, but lithium also has a very intrinsic relationship with vitamin B12. There are many patients with polyneuropathy who get B12 from their naturopath, and it still doesn't work. Why? The B12 is very high in blood, but it cannot appear inside the cells because for that process you need lithium. Lithium increases binding proteins for vitamin B12. And then selenium, of course, it's the antioxidant molecule or trace element, and it is very much involved with mercury. Here we see a comparison of the toxic metals. Again, gray, very high in the beginning. This patient responded well with a decrease of everything except mercury. And why? I will tell you. This was a lady who was a little short for her body weight. She was 167 and 127 kilograms, so very obese. But she had the most beautiful teeth, which were only crowns. And she had hypertension and a lot of other complaints. So I told her, well, we need to check in time with the biological dentist what is beneath your crowns, because I'm sure that it will be tons of amalgam, because they just put a crown over a little drilled filling, because it sticks well. No, I just did this all. It's a 10,000 euro, and no, I will not change. Okay, I said I will gently detox you, gently, but when the mercury does not come down, maybe you are more satisfied with the answer then. So everything went down. You see every metal almost invariably go down, except for the mercury, which even has increased a little bit, but that is just due to the mobilization we did with the specific algae we used in this concept. But when you see crowns, just be sure that in 95% of them, amalgam is situated below them. And what does antimony do? Well, it's a catalyzer for making plastic. And when she was coming everywhere where she went, she had a liter of water with her, and always drinking and sweating and drinking, and she accumulated the antimony, because her body accumulates everything, and then you also accumulate other toxic metals. The barium is associated with the calcium, same periodic table. Cadmium is cancer, mercury is neurodegeneration or autoimmunity, etc. She had some improvement in her oxidative stress because the aggression decreased by 13% and her antioxidation increased by 13%. So in the beginning, she had a negative value for the good and the bad species. And here, at least, it is an equilibrium. But I told her, if you won't change the things in your mouth, there is no hope for true regeneration. It's absolutely impossible.